Let's bring in Victorian Shadow Minister for Health, Georgie Crozier from Melbourne. Let's start with the resignation of Jenny Mikakos. Georgie, what did you make of that announcement and how it was handled over the weekend?
Well, Peta, it was extraordinary because, as you said, there was no discussion between the Premier and the Health Minister. She just sent him a text and gave her resignation. But interestingly, in her statement that she tweeted, there was no accountability or responsibility for the failings that she had overseen as Health Minister. She was resigning because she couldn't work with the Premier. So it just demonstrates the dysfunction of what's going on amongst this government. And with this government, we're in this pandemic, as they keep saying, we're all meant to be in it together, and you haven't even got the Premier and the Health Minister speaking with one another. And he said at the inquiry on Friday he hadn't spoken to her for some time. And I think his evidence on Friday in itself was quite telling about the dysfunction and the breakdown of the relationship there.
Now, I don't know Jenny Mikakos. You obviously would have a much closer contact with her over time in the Parliament. People say that she's very hardworking, that she's very earnest, pretty genuine, all of the things. Now, she may well be out of her depth. But I find it interesting that the Premier made it all her fault on Friday. But as Health Minister, and I've trawled through all the papers on the weekend, she had no capacity to bring in the police. She wasn't the one who procured the hotels and the security firms. We know that was Martin Pakula. We don't know who made the decision to do that, but the procurement without a tender was Martin Pakula. She couldn't call in the ADF. That's a matter higher up for Emergency Management Victoria. So it seems a bit tough when you look at it that she's gone because she didn't have ADF and police at the door of the hotel quarantine system. But of course, none of that was her responsibility.
Well, Peta, anyone who was watching the evidence last week in the inquiry, seeing that string of bureaucrats, 10 bureaucrats, 3 ministers and a Premier, all saying that they couldn't recall, or I don't know, the collective amnesia went on about who was actually responsible for hiring the security guards. That was why this inquiry was set up. Who was responsible? We know that 99% of the second wave cases and this mass devastation that has occurred in Victoria escaped through the hotel quarantine program and the breaches with the hotel security. This inquiry was set up to get that answer, and we still are none the wiser. And it is just amazing that all those people are still there, hold their jobs. The ministers had a spat and a falling out with the Premier saying, I can't work with you, so she resigns. And Victorians are left in the dark. We still don't know who made that critical decision. And I think it is just so disappointing for Victorians who have gone through so much. We're still facing uncertainties. So many businesses still don't know if they'll be opening or not on the 19th, even though the Premier's, indicating that that's his next step. Well, there's still so many grey areas, and the devastation and despair is, as I've said to you before, is really, really profound amongst the Victorian community.
You make a very good point, Georgie. If they can't remember something that only happened a couple of months ago, and there's a cavalcade of them, right? 15 or 16 of them can't remember. If they can't remember something that only happened this year, that just further strengthens your argument, Michael O'Brien's argument, that there's got to be a Royal Commission. Because the Royal Commission is far more powerful than this current inquiry. It would spread right across into contact tracing, testing regimes, preparedness going into a pandemic. Of course, let's not forget, before Daniel Andrews was Premier, he was also the Health Minister. So what was done or not done on his watch, a Royal Commission would have far more power. If these guys can't remember a couple of weeks ago, it's more and more important that a Royal Commission gets underway to capture their memories while they still can remember.
Of course, Peter, and to get those very vital documents and information that a Royal Commission can compel to have before it. This was a board of inquiry. It didn't have those powers. So there are still so many gaps. We need to understand exactly what went on, who made those decisions, the phone calls, the emails, everything that still are unbeknown to us all. And, of course, looking at the DHHS structure, how those decisions were made, who was meant to be in charge, why it wasn't in charge, and really that, the crisis cabinet of 8, the gang of 8, what on earth were they doing, for goodness sakes? I mean, seriously, these are really serious discussions that were and decisions being made on behalf of every single Victorian. we're still living under the most draconian of restrictions, and we've had the worst outcomes of any state in Australia, and nobody can tell us, and that's why we need a Royal Commission to get to the bottom of that, to have more probing on all of these issues, because Victorians deserve so much more than what we've seen, and they just want honesty. They just want the truth. They want an honest government, and they haven't got that at the moment.
Georgie Crozier, Opposition Shadow Health Spokesman, thank you for your time.
Thanks so much, Peta.